Hello, everyone. Today's discussion is one of the most uh, popularly known term, that is recent advances. We hear this term, of course, you guessed it right, in conferences. There are recent trends in that, recent trends in some sort of area or the field within physiotherapy. We hear a lot in conferences. So we thought that what it actually means, not what in the sense that how in the conference it's put across, but uh, what it is supposed to mean when we say recent advances, because we sense that there is a certain amount of confusion or differences of views or perceptions about what constitutes recent advances. So we thought we will discuss according to our own understanding what a recent advances is. Okay, so we have Mr. Hariom with us. I'll start off asking him what according to you is recent advances is in physiotherapy.
Right. Now, what I assume is in every every uh, every discipline of science or every parts of physiotherapy or every medicine, everything, there will be always some amount of ambiguity, right? Uh, we will have some amount of intuition that this is how we have to do it. And then there will be another group of people who will have another intuition. This is how we have to do it, right? So there will be always this ideas and ambiguities about whether it is the functioning of the brain or whether it is the how to give a treatment or what exercise. So there will be always some amount of ambiguity. And when the ambiguity gets clearer and clearer, I think that is the advancement you get, uh, whether it is in science or whether it is in physiotherapy.
Right. So generally, we hear this word not just in physiotherapy, it cut across all discipline. But the most simple and straightforward understanding is that in technology, where there is lots of recent advances are coming. And if you take communication technology, uh, it's a huge leap in the way communication has developed, including how we are using it. In my understanding, that how communication technology has come to the masses, that anybody, even without much of technical knowledge, is able to communicate with anybody across the world, is the huge uh, advancement which happened probably in the past 5 years or so. So whenever we say that means a recent advances is also something new. That's one part of recent advances. Second is recent advances. This is the way I see it, is something that makes better,
Right.
right? What you already had, it makes it better, or it solves the problem in a much efficient way, or in some cases faster than what it used to be. When faster happens, then the outcome or the goal of that particular intervention is we are able to achieve it more efficiently. That is how an advances that we should see. But the problem which I see is that the first part of advancement, which is new, that seems to have given more emphasis without actually looking into how exactly it solves the problem. Does it solve the problem better than the previous version, or does it better in terms of faster, in terms of, if you're talking about medicine, in terms of recovery, are we able to achieve faster recovery than it used to be, or are we able to achieve recovery which is not at all possible before? Say, for example, the one example that comes to my mind is how we are managing AIDS now. Like 15 years before, AIDS is really, really a huge problem. Now the life expectancy of patients affected by HIV positive is far better than it used to be like 10 years. So I think this is how we should first classify and advance in terms of how it made things better. What are your thoughts on it?
A- Actually, that's what I mean by uh, clarifying the ambiguity, right? Say you can say that uh, treatment A is better than treatment B. That's what I mean by ambiguity.
Yeah, yeah,
A is better. Some people might say B is better. So when I say that the clarity of the ambiguity is, okay, I'm seeing that A seems to be slightly better than B, or B is not working. That kind of clarity is what we need to achieve. Now, there are two things which is stopping this, I think. One is our language of not using empirical evidence is the first thing which is stopping us, right? As you have rightly pointed out, uh, because everybody uses an Apple phone, is it better than the other phones? Uh, what do you mean by better? That's another big question, right? As you have pointed out, in HIV, we know that after getting an HIV, your life expectancy is not as bad as it used to be. Actually, now you can live nearly as normal or as long as another person, right? So there is a clear way of defining what is better, right? So the two things here I see is the problem is what we mean by better. It works very well. What do you mean by well? We don't know still. In whole of medicine, not in physiotherapy, just the physiotherapy. The other thing is, as I told you, we just don't talk in empirical manner. We never talk like that. We never use that language, whether it is in conference or whether it is in our text. Whether it is physiotherapy or nursing or medicine, even MCH surgery, they still talk in terms of techniques and logic rather than empirical evidence. Nobody talks in that particular. So I think that is where uh, our biggest problem comes into play.
It's important that you pointed about empirical evidence, and which is not often considered when we discussed about recent advances. Just to go back to my example of technology, that when technology come to us, it has been tested multiple times and researched, and then evidence is, they tested, and whether it's an alpha version, beta version, and multiple versions, it's been tested, proved to do what it is supposed to do, and then only it comes to the masses. Many of them might not be aware that it goes through all these processes, and then it's coming to us. We just take it out, new technology has come, we'll take it. And I sort of think that in medicine also, we have anything new comes, somehow either we have implicit assumption that same process goes on, something new comes, it's all there, or what do you think? Is that what people are assuming, something new comes, it's implicitly tested and proven?
Uh, I will take a slightly a step back from what you said. Uh, Sometimes new does not mean it is better, even if it is
Yeah,
tested,
right.
alpha tested or beta tested or something. The clearest example is we all loved Windows 95. I'm assuming a lot of you were not born when that was there. And then Windows XP came. A lot of people did not like it, but Windows XP was okay. Nobody will remember Windows Vista.
Yeah.
It was one of the horrible, horrible products Windows launched. They have a marketing and testing R&D division with a GDP of probably the whole of Africa or something. So they still got it wrong. So what it means is they come with some amount of testing and it comes to the market. And then the real market tests it and find out whether it is good or bad. So there is some amount of testing before when it hits the
Yeah, yeah.
market. Uh, Sometimes that also does not happen as robust as we wanted,
Right.
but there is some amount of it, right? But when it comes to products which don't harm us, right, when you look into the cost and benefit, the cost is not that high, and the benefit, if it is there or not there, nobody cares. I think that is where there is a lax in the giving it the stamp of approval,
Yeah.
right? Whether it is herbal medicine, the so-called herbal medicine, because people think that the cost is very less. That is, you will not have any side effects, if you will. The same goes for physiotherapy also. I think people assume that the cost is very less, so you can throw whatever product comes to your lap.
Right. So the thing is, first of all, anything new comes, we need to know that whether it is tested, and even if it is tested, that doesn't mean that when we apply it, it will produce the same outcome as it produced in testing. And if in a clinical trial term, we say that no phase 1, phase 2, phase 3, and phase 4 trials. Most of the drugs comes out of phase 3 trials, and then they get the approval, and then in the phase 4 and where you apply it into a larger population, where it may produce same or similar effect, or sometimes it might produce harm which is not detected with a smaller sample. And all of us know many drugs have been withdrawn, on many other drugs are still not withdrawn despite knowing that it's not working. That's a different story, right? So we in physiotherapy also, when we talk about when we hear recent advances anywhere, I think, just to summarize, we got to ask two questions. What was it tested, and what was the outcome of that testing? Secondly, even if it is there, when you implement it, we still needed some kind of monitoring mechanism. And more importantly, when the mechanism shows that it's not working, and it ceased to be a recent advance. It's just thought to be a recent advance, and it no longer is.
Yeah, as I told you, simplest thing to look for is the empirical evidence, not the logical evidence. Logistically, we can rationalize anything. One of the reasons why we can do that is because we don't know most of the variables. We can leave out hundreds of variables, and then we can make a logical assumption. But when it comes to empirical evidence, it's slightly better. So always ask for the empirical evidence. That I think is a hallmark of advance.
Okay, so with that remark, we conclude this session. Let us know how do you like it. Feel free to comment whatever you feel like. We are very democratic. And yeah, any other topic, if you are interested, let us know in the comments, and also subscribe to our channel. Goodbye, everyone.
Thanks so much.